The success of a microdermabrasion treatment depends on the esthetician's technique as well as the power of the machine used. Microdermabrasion machines work with crystals, diamond tips, or ultrasonic paddles in conjunction with a vacuum to exfoliate the skin while simultaneously stimulating blood flow to the surface of the skin. The best candidates for microdermabrasion are those with rhytides, fine to medium textured skin, photodamaged skin with hyperpigmentation, fine acne scarring, dyschromias, sallow skin tone, rough or coarse textured skin, or seborrhea keratosis. Contraindications for microdermabrasion include active acne in the form of pustules or papules, rosacea, sensitive skin, bacterial infections, viral skin infections such as herpes simplex, shingles, warts, open lesions, burns, rashes, dermatitis, fungal skin infections, cysts or nodules, use of Accutane within the last year, and immediate post-operative cosmetic facial surgery. Pregnant clients should obtain written approval from their physicians prior to treatment. Microdermabrasion results include reduction in pigmented lesions, superficial acne scars, and rhytides. It also helps produce collagen, which results in an improved skin tone and texture over a series of treatments. Before your client arrives, perform general treatment room setup, including preparation of the treatment table with clean linens, preparation of disposable items, towels and equipment, and organization of products for efficiency. You will need client eye protection, a particulate mask, gloves, disposable sponges or cotton pads, a water bowl, cotton rounds, a cleanser, toner, tissues, a soothing serum or lotion, a moisturizer, and sunscreen. When your client arrives, have them complete the intake form and the informed consent form. Escort the client to the treatment room and have them prepare for the service in a standard manner. Discuss the procedure and post-treatment with your client. Position the client comfortably in a relaxing, reclined position. Make sure to protect their hair. Before touching the client's face, wash your hands with antibacterial soap and put gloves on. Have your client remove all facial piercings and jewelry, as well as contact lenses, before beginning the procedure. Begin by removing the client's makeup thoroughly with a cleanser. Make sure to remove all eye makeup, as well as lipstick, with a cleansing agent and cotton rounds. Remove facial makeup with cleansing lotion and rinse the face with 4x4 gauze pads or warm, moist towels. Then, degrease your client's skin according to manufacturer's recommendations. An astringent cleanser may be used to remove all dirt, makeup, and oil. Alternatively, in a medical setting, acetone may be used. After degreasing, dry your client's skin. Blot excess moisture with a tissue to ensure that their skin is completely dry. Protect your client's eyes with occlusive, adhesive eyewear, pads, or moistened gauze. If you are using crystals, then you will need to provide your client with goggles. You should then put on protective apparel and gloves. Place on a disposable tip and then turn on the machine. Follow the manufacturer's recommendations for pressure settings, time exposure, and treatment protocol. Test the microdermabrasion machine to assure proper flow of air and crystals. Before the procedure, conduct a test pass adjacent to the area that is to be treated. The skin should turn slightly pink, but the client should be comfortable. Ask the client to rate their discomfort on the medical pain scale from 1 to 10, with 1 being no pain and 10 being the most uncomfortable and needing to end treatment. The client's response should never be over 5. A rating of 2 to 4 is comfortable and safe. Begin with low settings and increase as you determine how the client is tolerating the strokes. Start the procedure on the right half of the forehead. Using your non-dominant hand, hold the skin taut between your fingertips. The following demonstration depicts a basket weave pattern. However, it is also possible to use circular patterns. Make steady vertical strokes with the device, being sure to maintain constant pressure on the skin stretched between your fingertips. Begin at the center, just above the eyebrow, and work toward the hairline, above the temple. As you reach the side of the forehead, you can tip the device slightly, loosening pressure contact to ensure a smooth release. The next set of passes should be made in a horizontal pattern. While holding the skin taut, work from the eyebrows up toward the hairline. Repeat this in adjacent passes, working in rows up toward the hairline. Make sure you are using an appropriate pressure for your client's skin type, and make sure the client is comfortable. Repeat both sets of passes on the other side of the forehead. And then on each cheek, working from the nose to the jaw outward and from the orbital bone to the chin. Repeat both sets of passes on the nose, upper lip, and chin. The vacuum pressure should be reduced to the lowest possible level in the orbital areas. Never work on the eyelid itself. You should use the orbital bone as a guideline to prevent you from going too close to the eye. Eye strokes made with crystal devices should be from the inner corner of the eye outward to prevent crystals from getting in the eye near the tear duct. With non-crystal diamond wand devices, this stroke may be done from the outer corner toward the nose. As you move from one anatomical quadrant to another, you should pay close attention to any variances in skin condition. Adjust your technique based on these observations. In general, the number of passes influences the degree of tissue effects. 2 to 3 passes are usually appropriate for normal to oily skin. Thinner, drier, more sensitive skin may only require 1 or 2 passes. Also, every individual machine will dictate how many passes are needed. Some manufacturers may recommend up to 7 passes. It is up to the esthetician to determine the number of passes required to accomplish the desired results based on these variables. Specific areas are handled with specific techniques. The neck should be hyperextended, and passes should be made in a vertical direction. Use a lower pressure than used on the face, starting at the jawline and stroking downward. When treating the décolleté, start in the center of the chest and stroke outward, being sure to hold the skin taut. When working with the hands, you should instruct your client to make a fist to produce a taut skin surface. Passes on the forearm should be made in a vertical direction, along the forearm. After completing all microdermabrasion, brush away any loose crystals and rinse the face with water to ensure all crystals are removed. You may follow microdermabrasion with normal facial routine steps, such as a mask or sonophoresis, or you may conclude the treatment with a soothing serum or lotion and sun protection. After the treatment, the client's skin may be tender or have a sunburned sensation. It may also have very mild residual peeling. Instruct your client to moisturize, use sunscreen, stay out of the sun, and avoid extreme temperature exposure. They should not exercise or apply foundation immediately following the treatment. Give your client instructions for home care, including the use of gentle cleansers and moisturizers and hydrating solutions, along with daily use of sunscreen. Give your client permission for resumption of foundation use and exercise on the following day. Your client may notice improvement after one treatment. However, a series of microdermabrasion sessions will offer a better outcome. Typically, 4 to 8 procedures scheduled every 2 to 4 weeks are recommended. Maintenance treatments are also recommended to promote long-term improvement of skin tone and texture. Perform cleanup and disinfection according to your state's regulations. Wipe down the device with disinfectant as recommended by the manufacturer. Dispose of any disposable components in an OSHA-approved bag inside a closed container. Dispose of the used crystals to prevent clogging in the machine. Check all filters and tubes based on manufacturer's directions. If you are using a crystal-free machine, remove the cotton filter with tweezers and dispose of it. Replace the filter with a new, unused one. Sterilize any reusable components based on manufacturer's instructions. Remove the applicator for disinfection and sterilization. Vacuum the floor to remove any stray crystals. Microdermabrasion is a process that physically exfoliates the skin, as opposed to chemically exfoliating the skin. The best candidates for microdermabrasion are those with rhytides, fine to medium textured skin, photodamaged skin with hyperpigmentation, fine acne scarring, dyschromias, sallow skin tone, rough or coarse textured skin, or seborrhea keratosis. Microdermabrasion results include reduction in pigmented lesions, superficial acne scars, and rhytides. It also helps produce collagen, which results in an improved skin tone and texture over a series of treatments. Contraindications for microdermabrasion include active acne in the form of pustules or papules, rosacea, sensitive skin, bacterial infections, viral skin infections such as herpes simplex, shingles, warts, open lesions, burns, rashes, and dermatitis. A manual microdermabrasion cream contains aluminum oxide in a cream base. The difference between a manual microdermabrasion and a machine-operated microdermabrasion is a manual microdermabrasion will only exfoliate the skin, whereas a machine-based microdermabrasion will both exfoliate and assist in lymphatic drainage due to the suction feature. Before your client arrives, perform general treatment room setup, including preparation of the treatment table with clean linens, preparation of supplies, and organization of products for efficiency. You will need 4x4 gauze pads, a water bowl, latex gloves, cotton rounds for your client's eye protection, a cleanser to remove makeup, a cleansing massage product, a microdermabrasion scrub, toner appropriate for your client's skin, any necessary serums, a moisturizer, sunscreen, a gel-based mask, 3 to 4 warm steam towels in a hot towel cabbie, and a massage medium. When your client arrives, have them complete the consultation intake form and the informed consent form. Discuss the procedure and post-treatment with your client. Before touching the client's face, wash your hands with antibacterial soap and put gloves on. Begin by removing the client's makeup thoroughly with a cleanser. Make sure to remove all eye makeup, as well as lipstick, with a cleansing agent and cotton rounds. Remove facial makeup with cleansing lotion and rinse the face with wet sponges, 4x4 gauze pads, or warm, moist towels. After removing your client's makeup, swipe the entire face with cotton pads soaked in toner. At this point, you should re-evaluate your client's skin to assure that this is an appropriate treatment for their skin at this time. You should also discuss possible results with your client and confirm the appropriateness of the microdermabrasion treatment before continuing. You may also make home care suggestions and discuss a series of treatments if appropriate. You should precede the microdermabrasion process with a relaxing massage of the face, neck, décolleté, and shoulders. Remove massage medium with a warm steam towel. And place eye protection on the client, ensuring that it is secured. You should apply the microdermabrasion product to the client's skin following the manufacturer's guidelines. Starting with the right side of the forehead, stretch the skin between the thumb and fingers of one hand. Then, using the fingers of the other hand, make firm vertical strokes on the taut skin using a rolling action. After about 10 strokes, evaluate the skin for any sign of redness or irritation. If none exist, 10 more strokes may be performed, this time stroking in a horizontal direction. Repeat this process on the center and left side of the forehead. Then, move to the left cheek and repeat. Depending on the size and shape of the client's face, this area may need to be broken up into more than one segment. Continue moving to the chin and jawline, working over to the right side of the face and the right cheek. Repeat the procedure on the nose, followed by each half of the upper lip, stroking outward from the center line. Using very gentle pressure, stroke along the lower orbicularis oculi, following the orbital bone and using a classical massage stroke pattern. Move to the left side of the neck and repeat the stroke patterns in 2 segments or more, depending on the client. Repeat this on the right side of the neck. By now, you should have completed the entire face and neck. Use warm, moist towels or cotton gauze to remove all product from your client's skin. Wipe your client's skin using wet cotton rounds dipped in a toner appropriate for your client's skin type. Place on eye pads and apply specific serums and a gel-based mask appropriate for your client's skin. After 10 minutes, remove the mask with a warm towel or wet 4x4 gauze pads to conclude the treatment. Following the treatment, apply protective moisturizer and sunscreen appropriate for your client's skin. Go over post-care instructions with your client and advise on home care products appropriate for their skin. Remind your client to stay out of the sun and schedule their next treatment if in a series of treatments. Perform cleanup and disinfection according to your state's recommendations. Reset and prepare the room for the next client.